I'll begin by verifying my provider's orders and gathering my supplies. I have an NG tube, stethoscope, pair of clean gloves, a pen light, a cup of water, a pH test strip and specimen cup, water-soluble lubricant, tape, a 60 ml syringe, a basin, and an absorbent pad. Upon entering the patient's room, I'll close the door to ensure patient privacy, perform hand hygiene, and apply clean gloves. Hello, Mr. Smith. My name is Bessie. I'll be your nurse. May I see your wristband? Thank you. Can you please tell me your first and last name and date of birth? Thank you. Okay, Mr. Smith, your provider has prescribed you a nasogastric tube or NG tube for your current nutritional needs. This helps facilitate feeding and or medication administration. I'll begin by inspecting your nares, measuring the tubing, and inserting it through a nostril into the stomach. It's normal to gag during this procedure, so I have a cup of water here for you if you need to take sips while I insert the tube during swallows. Do you have any questions? Okay, we'll get started. I'll raise the bed to a high Fowler's position as tolerated and making sure my patient is in a comfortable and safe position. Next, I'll assess the patient's nares with my pen light. Ask the patient to hyperextend their head. The nasal tissue appears intact. There are no signs of irritation, abrasion, obstruction, or deformities. Now, Mr. Smith, can you please breathe in while I close one nostril? Breathe in. Good. Breathe in. Good. I've determined that the left side nostril is more patent, and I will use that to insert the NG tube. Now I'll measure the length needed by measuring the tube from the tip of the nose to the tip of the earlobe and from the earlobe to the tip of the xiphoid process. I'll remove my packaging and dispose of it appropriately. The measurement is reading at 50 centimeters. I will mark that with a piece of tape. Then I will place the tubing into a warm water basin. And place an absorbent pad across the patient's chest. All right, Mr. Smith, we're going to begin. If you need a break, just raise your hand for any breaths or breaks that you need, okay? Now, I'll lubricate the tip of the tubing with the lubricant. And with the natural curve of the tubing towards the patient's head, I'll insert into the nostril. I'll ask the patient to hyperextend their neck while inserting towards the nasopharynx. I'll guide and direct the tubing on the floor of the nostril towards the ear. If resistance is met, I would retract, re-lubricate, and use the other nostril. Once the oropharynx is reached and the patient starts gagging, I'll ask them to tilt their head forward and give them water. Pause momentarily, have them sip, take a break, and while they swallow, insert 5 to 10 centimeters each time until the mark is reached, 50 centimeters, the tape mark. Breathe, swallow. Breathe, swallow. Keep breathing. Swallow. Swallow. One more time, swallow. Once I've reached this mark, I would then temporarily anchor the tubing. Now with my syringe, I'll draw 30 milliliters of air, insert it with the tubing, withdraw 5 to 10 milliliters of gastric aspirate, remove, gently mix, notate the characteristics of it, insert a couple drops into the specimen cup, dip the pH test strip. According to facility guidelines, I'll measure this to what I have from the facility. The pH is reading 3.5. If there were any signs of incorrect placement, I would withdraw and begin again. The pH test strip is within normal limits. I'll continue. I'll anchor the NG tube with a piece of tape that is split. Gently remove the temporary anchor. From the bridge of the nose, I'll get each strip, wrapping it around. In opposite directions to anchor the NG tube to the nostril. Next, I'll get another piece of tape and secure the NG tube to the gown. Once I've secured it, I'll lower the bed to the lowest position, confirm with X-ray of correct placement. X-ray has confirmed correct placement. I'll now go over NG tube care with the patient. If suction was applied, I would secure I would clamp the tubing after X-ray has confirmed placement, or apply it to a suction device or feeding apparatus if prescribed. Then I'll go over NG tube daily care with the patient. If suctioning was applied, I would maintain patency of the NG tube and suctioning source, suction tubing. And I would also notate the amount and characteristics of the drainage. Now I'll remove any unnecessary supplies, dispose of them appropriately, remove my gloves, dispose of them appropriately, perform hand hygiene, make sure my patient is in a comfortable position, and document the procedure. I would document what care was given, what assessment data was collected, and how the patient responded to the procedure.